So today I want to discuss something about breast lift. So hi everyone, I am Dr. Anirban Ghosh. I am an aesthetic plastic surgeon. So you must have heard of this term called breast lift. So who are the candidates who need breast lift? Basically, there are females who after pregnancy, after breastfeeding, they have sagginess of breast. They are the perfect candidate who should go for breast lift. Now, what are the symptoms which can suggest you to have a breast lift surgery done? Like these females, they then generally have heavy breast, and what happens is they have chest pain, they have neck pain. So these are the perfect candidates for breast lift surgery. Now, what is breast lift surgery? Now, breast lift surgery deals with taking off some portion of your breast volume, that is reducing your breast volume to some extent and repositioning it to a higher level. That is, when the breast sags down, it has to be lifted, and the surgery which is done for this procedure is known as breast lift. Now, how many hours of surgery is it? So it is 3 to 4 hours surgery. Generally, we do it in a daycare fashion, like the patient gets admitted in the morning, we operate and we discharge on the very same day. I mean, how many days does it take to recover? So recovery per se is few days, 5 to 7 days. You got to wear a tight innerwear, but the stitches, they heal for at least 3 to 4 weeks. Now coming to any morbidity of the surgery, any particular thing we need to discuss about the surgery? Yeah, definitely we need to discuss something. Like if you are into some activities which will need you to strain out, then you need to take rest for at least 1 or 2 weeks. Rest of the things you can do from the very next day. And if you want to know something more about breast lift surgeries, you want to know steps in details, you want to know the cost, then do connect to me. You can help me out with a subscription of my channel. You'll see many more videos on breast. Thank you.